everyone, this is Dr.Sukhmeet Bedi. Welcome to Anatomy and Physiology. Today I will explain the topic hemostasis. Now what is hemostasis? It is the process of cessation of blood loss from a damaged blood vessel. Now this process of hemostasis, it includes three phases. The first phase is the vasoconstrictive phase, second is the platelet plug formation, and third is the blood coagulation or blood clotting. Now the first phase, vasoconstriction, it includes vascular spasm. That is, the blood vessels, they get tightened, their diameter gets decreased so as to prevent the blood loss. And this is due to the smooth muscle contraction. The smooth muscle which is present in the wall of the blood vessel, it contracts, and the vessel wall, it constricts, the opening constricts. The second phase is the platelet plug formation. This phase involves three steps. The first step is the platelet adhesion. Now the platelets, they come together and they adhere to the damaged tissue, or they attach to the damaged tissue. Second step is the platelet activation. Once they attach to the damaged tissue, they get activated. And when they are activated, a platelet release reaction occurs where three chemicals are being released. The first one is the serotonin. This serotonin, it enhances further the vascular spasm. Second one is the ADP or adenosine diphosphate. It is a potent platelet aggregator, and more of it, what it does, it enhances more of platelets to aggregate. And third is thromboxane A2, which causes vascular spasm as well as the platelet aggregation. Then is the third step in the platelet plug formation. The third step is the platelet aggregation. Now, because of this thromboxane and the ADP, what happened? More and more of platelets which are around in the surroundings, they get sticky and they are attracted towards the damaged site. They collect over there, they aggregate over there, and they clog the opening, and the blood loss is prevented. Now is the third phase, that is the phase of the blood coagulation. In this phase, what is involved is the clotting factors. These are a number of chemicals which are present in the blood, which are responsible for blood clotting. Most of these clotting factors are released by liver. Some of them are released by platelets, and some are released by the damaged endothelial cells. So let's talk about the clotting factors. There are 13 clotting factors. The clotting factor number 1 is the fibrinogen, which is released by the liver. Clotting factor number 2 is the prothrombin, which is also released by the liver. Clotting factor number 3 is thromboplastin, which is released by the platelets and the injured tissue at the time of blood clotting. Clotting factor number 4 is the calcium ions, which we ingest through our food. Clotting factor number 5 is proaccelerin, which is released by liver and platelets. Clotting factor number 6 is absent. There is no clotting factor 6. Clotting factor number 7 is proconvertin, which is released by liver. Clotting factor number 8 is antihemophilic factor, which is released by the platelets and the endothelial cells. Clotting factor number 9 is the plasma thromboplastic component, the PTC, which is released by liver. Clotting factor number 10 is the Stewart-Power factor, which is also released by the liver. Clotting factor number 11 is PTA, plasma thromboplastin antecedent, which is released by the liver. Clotting factor number 12 is the Hageman factor, which is released by liver as well as the platelets. And clotting factor number 13 is the fibrin stabilizing factor. Now you should know one thing, that factor number 2, 7, 9 and 10, they require vitamin K for their production. So this is about the clotting factors. Now this blood coagulation phase, it involves 3 stages. The first stage is the stage of the formation of prothrombin activator. In the second stage, what happens is that this prothrombin, it is converted to active enzyme thrombin. And in the third stage, the fibrinogen, it is converted to fibrin. Now the first stage, that is the activation of prothrombin activator, it includes two pathways, extrinsic pathway and an intrinsic pathway. First we will talk about the extrinsic pathway. Why the term extrinsic? Because factors outside the blood, they are involved in this pathway. This pathway starts with the activation of the clotting factor 3, which gets activated by the damaged endothelial tissue. So it is something outside the blood. That is why the term extrinsic pathway. Now extrinsic pathway, it's a short pathway, it's a shortcut mechanism, and the amount of thrombin produced is less and the size of the clot is also small. It just involves the two steps. Now activated factor 3, it activates the factor 7. Now activated factor 7, it activates the factor 10. Now activated factor 10 and activated factor 5, both of them, they form the prothrombin activator. Just it's a small pathway and it takes just 12 to 15 seconds. That's it. And the second pathway is intrinsic pathway, which is a long pathway. It takes more time, that is around 20 minutes. The second pathway is the extrinsic pathway, which takes around 12 to 15 minutes. The amount of thrombin formed is also more and the clot formed is also bigger in size. It's a long pathway. It starts with the activation of the factor number 12. This factor 12 is activated by the exposed collagen. Now activated factor 12, what does it do? It activates the factor 11. We will move in reverse counting. 12 will activate 11. Now 11 is in Roman numeral, just move it the other way. Then that becomes 9. So activated factor 11 will activate the factor 9. Activated factor 9 will activate the factor number 8. Now this activated factor 8 will activate the factor 10 in the presence of calcium ions and factor number 3. This 10 activated factor along with 5, what does it form? Prothrombin activator. So now both the intrinsic pathway and the extrinsic pathway are giving us prothrombin activator. This prothrombin activator is what? Activated factor 10 and 5. These both pathways just end up into a common pathway. The stage 2 and 3 is a common pathway. Now the prothrombin activator, it enters the stage 2. क्या नाम है इसका? Prothrombin activator. So it will activate prothrombin to form thrombin. Thrombin is the active enzyme now. This thrombin will do what? It will convert fibrinogen to fibrin. The fibrin threads will now entangle the red cells and the clot will be formed. Now once the clot is formed, what starts is clot retraction. It starts tightening. The clot starts tightening. And because what do they do is they bring the two damaged vessel parts nearby so that the chance of further hemorrhage is reduced. After the clot retraction, the last step is the fibrinolysis. That is the fibrin clot, it will undergo breakdown. It dissolves. When the fibrin clot dissolves, all the material whatever is left, that is considered as the waste material and phagocytosed, and the normal epithelium is maintained. So this is all about hemostasis. I hope this is clear to all of you. Thanks for watching. Have a nice day.